So I now like to move on to introduce Tim Strahan, Director of NHS at Home and NHS England and NHS Improvement, who is going to make a presentation. Thank you.
Good evening, my name's Tim Strahan. I'm the Director of NHS at Home at NHS England and Improvement. Very sorry I can't be with you today, but I was just going to go through a few slides for you and just explain where our thinking is at the moment around the future of virtual wards and remote monitoring and where I think we're going next. So just going to talk through a few slides and then hand back. So just want to start by talking a little bit about what we've been doing in response to COVID-19 and in particular two initiatives that we've set up under the NHS at Home banner. The first you may have heard of is called COVID Oximetry at Home, where we've set up in every CCG now a COVID Oximetry at Home service where essentially patients can be onboarded where they've been identified at high risk of deterioration, with the view that actually by giving them an oximeter and some instructions with or without tech support, they can then escalate if their oxygen sats drop to a dangerous level where they need attention. And the idea is that if people are detected early, they get earlier treatment and the outcomes are much better. It saves lives and less time in hospital, and that's worked really well. So we've now got that live across the whole country. And then the second initiative we've worked on is COVID virtual wards, which is slightly different. Again, for patients with COVID, that these are patients that have actually either been in hospital with COVID and are on an improving trajectory, that are able to be discharged a bit earlier than normal because they can go home, again, with the right monitoring by secondary care clinicians that have been looking after them to make sure that they stay well and they continue to improve. And if they do need some extra help, they do come back in promptly. But also it's being used increasingly to help with admissions avoidance. So people that are going to A&E that aren't sick enough to admit, but actually aren't well enough to let go or discharge. So they're going home into the community again with supervision and support from secondary care. So two initiatives that are working really well. They're pretty much universal adoption now. We've got just about every trust in the country now with a COVID virtual ward. And that's provides significant learning and opportunity and culture shift really for us to move into the next phase, which is really around restore and recovery as we try to go back towards a long-term plan. But as part of this, we've been working very closely with NHSX colleagues, and I think Breed's on the panel with you today. What they've done, as well as this, these pathways, is help us by establishing tech support really for now up to 87 sites that are using technology now to link those pulse oximetries, those oximeter readings, to a digital platform. And again, working with them on the evaluation, that's again starting to show some very promising signs, which we're still in the process of evaluating. I'm working very closely with them around the wider opportunity to scale up virtual wards for other pathways, for other conditions other than COVID. And so they're looking to invest further in licenses and kit and implementation support. That's working very closely with us to make that offer available across the whole country. So some really exciting things happening in that space, which I'm sure Breed will tell you more about. So thinking more about how we now use that learning and opportunity to support the ultimate achievement of long-term plan, which we all want to go back to. We're looking now at how the NHS at Home initiative can sort of do a number of 5 things which were outlined in the original long-term plan. So looking very much around how we now move to a much more bigger offer around out-of-hospital care, so supporting people in home-based services, largely through primary community care services, but using latest technologies and pathways to be able to do that. As well as building on the virtual awards initiative and supporting people at home that helps also take pressure off emergency services. We're doing that within the personalised care group of NHS England. So personalised care is a massive part of this. All of the pathways that we develop and work and supports local systems with, we want to make sure are personalised, they work for people. So it's not about enforcing one particular solution or way. It's about having meaningful conversations around what matters to people, having good care plans, budgets where appropriate, etc., social prescribing. So that's working really well with the personalised care team. And obviously, as I mentioned, working very closely with NHSX and NHSD colleagues around, digitally enabled solutions. So massive opportunity now, real appetite, groundswell of opinion to do that, which is huge. As well as working now with the ICSs that are established around population health-based approaches and really focusing on the people that could most benefit from these approaches to help inequalities. So just to say a little bit more, and this is the last slide really, around the model that we're developing to help make this happen in terms of an offer to local systems, which hopefully is of help. And we're now starting to think about different tiers or different levels of support for people at home that can be enabled by tech and remote monitoring. So really thinking about whole population models. So starting with level 0 at the bottom. So this is for people that are generally well, most of the population that have no symptoms but still need to look after themselves. This is encouraging people to self-manage their health and well-being at home, stay well, and that may well have a role for self-monitoring, people knowing what's normal for them, measuring their own blood pressure, their oxygen sats, their doing their daily steps, etc. So that's the prevention layer. So level 1 is all about proactive care at home, which is really for people with one or more long-term conditions. So these are people that are at higher risk of and can benefit really from more higher levels of proactive care. So we're initially looking at 6 pathways, working with UCLP and a number of other academic health science partners around CVD and respiratory pathways initially. So this is helping with hypertension, diabetes, COPD, asthma, those sorts of things. So that's really, I think, going to be a really helpful initiative to help those people that haven't been going to the GP or haven't been accessing services during the COVID period that really do need some proactive help and support. So we've got a big push around that. And then level 2 is for those people that are at a higher risk of deterioration with even more complexity that really need a lot more coordinated care. So massive opportunity there for technology to help with that. So this starts to get into some of the anticipatory care needs of people, or for the frail, some of those people with really complex conditions that need multiple agencies and people to look after them, health and social care that could be in their own home or could be in a care home environment. So working up an offer around that. And then the final level is the virtual ward level, which are the subacute, the highest acuity patients. So these are patients that generally will be managed by secondary care, as I said earlier, that have been either in hospital and getting early supported discharge, or actually, helping them to avoid admission altogether, or giving an alternative pathway for those people. So this is an offer we're working up across NHS England with many policy leads, different programs, working with lots of different partners, and we think this is a really exciting opportunity to work with you guys and really make a massive difference, lock in some of the beneficial changes that we've got from COVID into restoration and the achievement of our long-term plans and objectives. So thank you. I'll stop there and I'll hand back to David. Thank you.
Thanks very much to Tim for a very interesting and encouraging description of the developments that are taking place in actually supporting people at home, utilising various methods and technology. So that's a very helpful and giving us an understanding of what the possibilities and opportunities are for the future.